being that it's Thursday morning out of the 8:30 news. We're into a segment we call What's Up, Doc. We have enjoyed this immensely during its entire run, where we've spent some time with the experts at Mercy Health. We pepper them with a few questions. They regret their choice of coming on the show with us, and everyone lives happily ever after.
It's about how it goes.
Isn't that how it goes? Generally.
Every time.
No, actually, we have a great time, and we learn all sorts of different things. And this morning, we're going to learn about the Mercy Health Family Medicine Residency Program, and we're going to learn about it from Dr. Seif, who's taken some time out of his day for us. Dr. Eid, good morning to you.
Good morning, and thanks for having me here.
Oh, it's a pleasure to have you. Tell us a little bit about you.
Yeah, so my name is Seif. I'm originally from Egypt. I just recently moved to Rockford in July to start my residency here in the Family Medicine Residency Program in Mercy Health. And I've been enjoying Rockford so far.
Yeah, I was going to say, your impressions of the town so far? You've had a good time? People are friendly? Everybody being nice?
I had a great time here since the time I got from the airport to working with patients here and then just like going out in the city. Everybody's actually very friendly here, and they're welcoming the fact that, we're like new doctors trying to help the Rockford community. And the only thing is might be a little bit hard was the weather, but I got used to that so far.
Yeah, not really your Egyptian type of weather, is it?
No, not at all. Yeah, we only have one season where I'm from, so this is definitely a new thing.
Don't tell anybody about us being friendly. We're trying to keep that a secret out there.
Sure. Okay. I'll keep that to myself.
So you're real quick. So you're new in town. Have you tried beefaroo yet?
Yes, I have, and I actually like it. It's right next to my house. Luckily, I still didn't gain weight yet, but it's pretty good.
We'll get the weight on you. Don't worry.
Yeah, he's checking all the right boxes here. Topic is basically the benefits of seeing a resident physician, and before we get into that, it might be helpful to define resident physician, Dr. Eid.
Yes, and that's actually a great question because a lot of people are not very familiar with the term. So a resident physician is basically a physician that completed not just the medical school and graduated from medical school, but they also have to pass what we call the USMLE board exams. So these are like the exams that every graduate, whether you graduated from here or abroad, they all have to take the licensing exams in the United States for them to get a temporary license to start working as a resident. So a lot of people have like a misconception of thinking, they're still students, but that's not the case. Students rotate through the hospital, that's for sure. But as a resident, they have to complete these 3 board exams, and then to get a temporary license in whichever state they're going to practice in, for them to work. So you're basically you're still a doctor. You're under training with you're under supervision, but you're not the same level as a student.
Yeah. So pardon, I'm wildly ignorant when it comes to things like this. So what's the difference between that and a physician's assistant?
Yes, so a physician assistant is a different type of degree. So physician assistants do not go through medical school. They go through what we call like a PA school, which is, I believe, depending on the state, but at least because I trained in New York a little bit, it was a 2-year program. And what they do is they help the physician in whichever specialty that physician that they're working in. But they don't have the same privileges as an attending physician. So in a residency program, so it depends on what kind of specialty that you're in. But for instance, my specialty, family medicine, it's a 3-year program. So after you're done with the 3 years, you get like the full permanent license, and then you have like full privileges as an attending physician. So that's the main difference. While the PA, physician assistant, they don't have like a medical degree or medical diploma certification.
And what kind of etiquette is there if I want to know who's attending to me? Is it gauche to just ask what your level is?
Yes, yeah, and usually I always introduce myself, and so as my fellow residents here, we always say like I'm the resident doctor here. Usually the other doctors we call attending physicians. They usually just pronounce them or introduce themselves as Dr. So and so. But if a patient wants to clarify, they can always ask, if the doctor is a resident or an attending. But a physician assistant will always introduce themselves as a PA, or like for instance, if they're a nurse practitioner. That's the main difference.
If you're just joining us, we're spending some time with Dr. Seif. He is with Mercy Health's Family Medicine Residency Program. We didn't get into what is it that drew you into family medicine?
Yes, that's also a good question. I like family medicine because I get to see patients from across all age groups, different from like newborn all the way to the elderly geriatric age group. Another main advantage is family medicine is a broad field, so I get to see all types of conditions, whether someone is having a simple cold, or needing like an admission for like surgical procedures. So we get to see all types of conditions across age groups. So it's very nice because you get to do a lot of different types of procedures. So you're not always like focused on one particular field or one particular specialty.
Is this something you knew you wanted to do your entire life as a kid? You said, you know what, I want to be a doctor. I want to help people. This is what I'm looking to do. Or was, hey, I'm going to be a soccer star. All right, maybe that didn't work out.
Yeah. Yeah, to be honest, I wasn't very good at sports when I was younger, but I had the influence from my family. I had a lot of doctors. Both my parents were physicians, so I had that influence at a young age. And then the fact that, you get to help people, you're an important part of their life, and especially when it comes to family medicine, because you also from the name, you get to see a lot of members of the same family. Sometimes a lot of my patients here that I started, sometimes I see the parents with their kids or even their grandparents or extended relatives. So it's nice to be, and the patients do consider you part of their family too. So having such a vital role like that in the community and also within families is a nice feeling to have, that you're providing some sort of help and support for the community that you're working in.
Going back to the residency program here, if the head doctor is not in the room with us, are you consulting with him or her on every patient you see, or are there some things that you handle autonomously?
Yes, exactly. So obviously, our residency program is a 3-year program, but that's one of the advantages of seeing a residence doctor here in our clinic or in any other clinic that deals with residents, is the fact that after I'm done with the case, I'm going straight to my supervising attending, so that's the attending physician, and I'm discussing the case with him or her. So the patients do get the benefit of having basically 2 doctors per one visit, and then as we progress, the supervision starts direct supervision and then to indirect supervision. Depending on the case, of course, and how acute or critical it is, then there's always going to be a direct supervision with us. But as we progress through our training, we get more autonomy and we get more independence. But regardless, the case is always discussed, whether I'm here in the clinic or I'm training in the hospital. I always have my attending physician with me, either directly or indirectly.
And is that a Mercy Health protocol, or is that the general protocol across all medicine?
No, so that's a general protocol across the United States. So all residency programs are governed by a certain board, which is called the ACGME, and these provide very specific criteria and certifications that every medical center. So any medical center that has the privilege or has the right to host a residency program, they have to go through a vigorous process, just how the residents have to go through a vigorous process of the exams and certifications to get accepted into a position. It's the same thing with the institution. So this is kind of a general board across all the United States in all institutions that have a residency program.
So if I'm drawing the proper conclusion here, that one of the major benefits of seeing a resident physician is, as you mentioned, it's a brain trust. It's a group. It's not just that one physician. As you mentioned, you consult with others, so you're getting the benefits of many, aren't you?
Exactly. So not just that, you're also getting the benefits of seeing a lot of physicians in one visit. Also, because we just started our training, so we don't have such a large patient base as our attending supervisors or the attending physicians. So also that provides extra time for us to spend with the patients. And I notice a lot of patients like that when, they get to talk more with their doctors, because the attending physicians obviously have more time constraints than us. So with us, they get to have more time. And another advantage is that since our schedule or our patient base isn't so large yet, so it's easier for patients to schedule appointments with us, even if it's on a short-term basis or short notice basis.
And again, I apologize if my nomenclature is off here, but how many resident physicians are contacting a one individual attending physician? Is it a 1-to-1 ratio, or is there a group of residents underneath an attending physician?
So yes, so the number of residents, that number does differ depending on each program. So at least in Mercy Health, the family medicine program in Mercy Health, we have 12 residents per year, but we have a ratio basically of 2-to-1 attendings. So basically we have 6 supervising attendings here, but not all of us are always in the clinic. So basically, the majority of the time as part of our training, we're supposed to be working in the hospital as well. And then we come to the clinic, that's basically because we're family medicine. So we do come to the clinic at least once or twice a week. And sometimes we have a whole month here that we spend in the clinic. So we have like basically 6 attendings for like per like the residents that are in the clinic. But usually per day, there's around like 3 to 4 residents.
You've got to be really happy with a ratio like that because, you know, I think it would definitely help you keep that feeling of your head is above water. You're not being overwhelmed.
Exactly. And like all of our attending physicians here are very supportive. They provide very good like education and training for us. So whenever even we need like an extra hand or help, they're always there to help us. But that's a very good point because if we didn't have so much like supervising attendings, then obviously that's going to be like overwhelming because there's only going to be one attending supervising like if multiple residents. But at least in our case, we do have a lot of residents, a lot of supervisors or attendings per resident.
And at the end of the 3-year program for resident physicians, do all graduate on to become not attending doctors, but real doctors? Again, I'm bad with the nomenclature.
Fully credentialed?
Thank you, fully credentialed. They go on to?
Yeah, no, I understood the question. So actually, yes. So after we're done with the 3 years, you are going to be an attending physician, just the same thing as our attending physicians right now. So basically, the only difference is we then sit our board exams. So that's different than the exams that I previously mentioned when we graduate. Those initial exams, the USMLE, those are just licensing exams. But after we're done with our training, we do the board exam in our final year. So by the time we completely finish the 3rd year and graduate, we're going to be attending physicians just like our supervisors here in the clinic. So you'll have like the full privileges of a fully licensed doctor. So instead of having the temporary license, which I have currently, I'll have the permanent license.
It sounds like a wildly comprehensive program that you're in the midst of.
Oh yes, because like this is as I mentioned earlier, you know, it's like very vigorous. There's a lot of like certifications that have to be met, a lot of certain criteria that every resident has to be met. And the good thing about it is it's governed across the United States by the board that I mentioned, the ACJME. So that kind of makes sure that, you know, that every attending physician, when they graduate from residency, you know, they're kind of having like a standardized like quality of care. So everybody's basically on the same level. Obviously, some residents or some attendings can specialize into a different field. But at least once we graduate from our family medicine resident, we'll be competent and like licensed to provide like attending level care in terms of a family medicine perspective.
Outstanding. Well, Dr. Edith, for listeners who are intrigued by what you have told us this morning, how do they schedule an appointment with you or another family medicine resident?
Yeah, so the best way to schedule an appointment would be like calling our clinic directly. So the number is 815-971-3310. So that's a direct phone line to our Mercy Health Alpine Clinic. Another way that they can do it is through the general Mercy Health telephone line, which is 971-2000. And then they can ask for the Alpine Clinic, which they can get transferred to. These are mainly like for new patients that are not established with us here.
Sure.
Patients that are established with us here, they can also make an appointment through the MyChart system, which is a kind of system where it helps patients like see their lab results here, and like even instead of calling the doctor, they can send us messages like straight through our like electronic medical system.
I got to tell you, I have that app on my phone. I love that.
Yeah, it's very convenient for patients. You know, they get to see their results. Sometimes I send them, as long as it's like a normal lab results, I can send them messages straight away. But like if it's something abnormal and I want patients to like follow up on a certain procedure, I usually rather call them on the phone, basically to provide more like support. And that's something also another benefit that residents have, since we have a little bit more time than our supervisors. We can spend a little bit more time with them on the phone, help them understand their labs and so on. Basically, help them improve their care in general.
Outstanding. Well, Dr. Reed, we appreciate you taking time out of what we know, just from your description, is a very, very busy schedule. This was very enlightening, and we appreciate your time this morning.
No, I enjoyed it very much, and thank you for having me again.
Have a great rest of your day. That's Dr. Seif with Mercy Health.